Combination therapy. In this segment, we're going to talk about and demo how to combine e-stim and ultrasound together out of the ultrasound applicator. The treatment approach here is to treat a trigger point or trigger points. The mechanism of action is to combine both the therapeutic heating of ultrasound and motor tens to decrease the trigger point sensitivity. The clinical example in this case is chronic trigger point of the upper trap. We're going to show you both one example of how you can actually use the ultrasound applicator in this particular setup literally as a point stimulator to target a specific point like a trigger point. And also we'll finish up by combining both ultrasound and e-stim. First, ensure that the green lead wire is both attached to the channel 2 output of the device and the electrode attached to your patient. From your home screen, you'll select the combination option, and then you will select manual operation. We're going to select the waveform biphasic and symmetrical biphasic. The default parameters on the screen are set for this treatment. At this point, we're going to select the voltage for the stem for biphasic, increase to the desired physiological response, which in this case is a twitch motor level response of the target tissue. And you can now use the ultrasound applicator as a point stimulating device, or maybe a probe where you can really target those trigger points. When you want to combine ultrasound into a combination mode, you select the ultrasound option, change the frequency to 3 megahertz, select your intensity, and increase it to 1 watt per centimeter squared. The unit is already set up, so all I'm going to do really is apply the gel to the target area that we're going to be both stimulating and sonating. And then we'll go to the device, and the first thing I'm going to do is select the voltage for the stim that we're using, and simply go ahead and make contact with the target tissue, and then increase the amplitude to where you start to see a really good visible fasciculation of the trap, really hitting those motor points. Does that feel okay to you? Nice nod from the patient. I can see a nice visible contraction and fasciculation of that muscle. Now I can go ahead and just move that stem around and target that trigger point area, or I can just simply find that real good area that it's giving me a lot of good feedback and a reaction, and just keep that point stationary right over it. Remember, this is stim, okay? Or I can continue to move it around. Now, if we want to go ahead and combine this with therapeutic ultrasound during the therapy, I can simply go to the watts per centimeter squared and increase my intensity to 1 watt per centimeter squared, and you'll see the green LED light now is emitted and it's solid. That means that we have really good contact and coupling, and we're getting ultrasound emitted out of the applicator at the same time that we're delivering e-stim.